please take us inside what the president and his team had to be looking at to recommend 30 more days of being hunkered down when we know the president was very eager to get the country back to work much sooner than that.
Well, I'm glad in this case that President Trump listened to the science and followed the guidance of public health experts, because frankly, there is not one public health expert I've spoken to who thinks that releasing the restrictions is a good idea at a time when we have an escalating number of cases where frontline healthcare workers are begging for supplies, begging for ventilators, knowing that we are rationing supplies and that ultimately patients' lives are on the line. So I'm glad that we're continuing these restrictions. But I also hope that during that time, we'll use the time that we're buying wisely, in the sense that we have to stabilize our healthcare system. We have to ramp up testing. Look, we can point fingers and look back and say, all these things should have been done differently. And a lot of things should have been done differently. But now we have a chance to move forward and really act with the urgency that we need. And frankly, looking at this concept of up to 200,000 people dying, even if we act, as you were saying, Nicole, perfectly, I mean, that's terrifying. And that's why we need to do everything that we can as Americans to practice social distancing, while the federal government does everything it can in order to produce supplies and really make sure that we are acting with the urgency and in a coordinated manner that our country needs at this time.
I'm so glad you hit on that, because that number 200,000, you have to be sort of stripped of any humanity not to feel knocked over by that. To hear them saying that if we're perfect, the best case scenario is that 200,000 Americans will die. How do we process that?
And we think about what that means in terms of the number of people who will become infected and the number of family members who are going to be affected by all of this. I mean, the pain and suffering that is coming our way in America, I think is just something that we can't fathom right now. But we also have to recognize that all is not lost at this point, that we can do our part. We can certainly do our part when it comes to preparing our families and talking to our families and doing everything we can to practice social distancing. But I think we also need the federal government to really step up and say, this is the best case scenario. So how do we prevent the worst case scenarios from happening? And that includes not forcing hospitals to ration their resources, because that will be the most tragic of all if people who could have survived are now dying because we just weren't able to treat all of them in a timely way.
Phil Rucker, if you could pick up that thread from Dr. Wen, you know, last night's Rose Garden performance from this president, and I know he views them that way, so I think it's fair to call them performances, was all things Trump. There were moments where, as Dr. Wen said, it appeared he'd yielded to the advice of his scientists and medical professionals, and I think everyone is happy about that. But there were also flashes of the Trumpiest Trump, getting into it with a CNN reporter, lashing out and cutting the microphone of Yamiche, and really refusing to accept the premise of a shortage of supplies, which every governor is concerned about. Talk about, take me inside this Trump White House at this moment.
And Nicole, to add one more Trumpy thing, there was the suggestion, although Trump didn't really clarify what he meant, that perhaps local officials and hospitals had been hoarding PPE, the supplies that they've so desperately been needing. Now, the president last night said that he made this decision to delay the guidelines through the end of April based on science, on the data that was presented by Dr. Fauci and Dr. Birx. But as with so many decisions President Trump made, it was also about the personal and about the political. Our reporting shows that over the last week, a number of his political allies, including Senator Lindsey Graham, were privately warning him that if he were to reopen the economy prematurely, he would be responsible in the November election for all the deaths that follow. And he's thinking first and foremost, of course, about his own political survival and the election. And then he talked last night about those images he saw from the hospital near where he grew up in Queens, his New York neighborhood. And he said he saw body bags being put into these freezer trucks. And it seemed to be a moment that really struck him, the severity of this crisis, because it was personal, because it's the hospital. He recognized the place that he had been so many times. Oftentimes with Donald Trump, it takes that personal element for him to really comprehend the suffering of so many people because he's thinking about himself a lot.
That attack on the medical personnel for doing something worse than hoarding was his statement last night. Governor Cuomo responded to that, Phil Rucker. Let's listen to Governor Cuomo's response and talk about it on the other side.
For someone to say, well, the warehouse has equipment in it, you should be using that equipment today. That defies the basic concept of planning and the basic operation that we have to have working, not just in this state, but across the country. If you are not preparing for the apex and for the high point, you are missing the entire point of the operation. In terms of a suggestion that the PPE equipment is not going to a correct place, I don't know what that means. I don't know what he's trying to say. If he wants to make an accusation, then let him make an accusation. But I don't know what he's trying to say by inference.
Phil Rucker.
Yeah, Nicole, that was an explanation from the governor about why he is keeping these ventilators in a warehouse. It's not some sort of criminal or wrongdoing on his part, as the president has been insinuating the last few days. Rather, he's acting almost like as if he were Amazon. You collect all these goods, you put them in a warehouse, you wait until you find out exactly where they're needed, and then you can deploy them efficiently and effectively in emergency situations. And that's what he's doing with this equipment. It's not needed today, but of course, the officials all think it's going to be needed 10 days from now, 2 weeks from now, a month from now. And that's why he's bringing it into New York and putting it in place.
Dr. Wen, can you talk about how quickly this equipment is needed when a city faces a crisis and why so many ventilators are needed? I've read in the New York Times and in the Washington Post that the reason that so many ventilators are needed at once is because people are staying on ventilators for 20 and 30 days, which is not typical with a common flu season.
That's right. And the federal government's own study showed that in a case of a moderate outbreak, that we will need something on the order of 200,000 intensive care unit beds. The U.S. at any given moment in time only has about 100,000 ICU beds. So you can see that the demand for these acute care services will far outweigh the supply. And so we do need ventilators. We need ventilators that will help people to stay alive, because at that moment, patients are so acutely ill that they cannot breathe on their own. And they have to stay on these ventilators, Nicole, as you said, for multiple weeks in order to get them through that acute period. And I'll just say that the idea of accusing healthcare workers somehow of hoarding supplies or worse is so insulting. I mean, I wish that President Trump would go to hospitals and just see how personal protective equipment are used and how desperate healthcare workers are, how they're facing their own death potentially and compromising their own families' lives in order to save patients. And today is National Doctors Day. And I just want to take a moment and thank not only the doctors and nurses and respiratory therapists, but all those who are putting their lives on the line and who desperately need this equipment.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.